Okay, this is NYC Pain MD, and it's a real medical clinic in New York City, and treats a lot of arthritis pain, hip, knee, shoulder. We're going to talk about knee arthritis pain today, and specifically a treatment that is getting great success. It's a gel injections or viscosupplementation, and I'm going to show you guys some video, some really cool stuff, and I'm going to give you guys some proof, some research that this stuff works, and it works extremely well. And there's a lot of knee arthritis sufferers are getting tremendous relief. They're putting off total knee replacements by over 7 years, and the research I'm going to show you in a minute proves that. And a lot of patients are just getting relieving a lot of their pain, some of them eliminating it. So first off, I'm gonna show you a video here, and it's gonna talk about arthritis animations so you can see how all this stuff works. All right, this is a really cool video, and it shows animation of a gel viscosupplementation injection. And I'll play it fast, and I'm gonna play it slow and talk about this. You can see it. Here comes the gel, and it goes into the joint and lubricates and acts as a shock absorber and helps the joint to move, decreases pain and stuff. So I'm going to show this slower here, and as the joint comes in, okay, the gel, the injection has to be precise. Okay, here, imagine if this injection is off a little bit. Okay, it has to be precise, and it has to be right in there. So I'm going to show you here grade 4, which is what the study was done with. This is grade 4. Okay, let me show you. Here's the four grades, and you can see here there's a lot of space. Grade 2, the space starts to shrink. Grade 3, it shrinks much more, and then 4, you see this is really bad here. So this is grade 4. I blew up that picture there, and you could see this space here, okay? And you could tell that it's much easier to miss that joint space right there than even on the other side here, okay? So it's extremely important that the proper imaging is used so that they can see into the joint space, so that they can see this up on the video screen, and they could get that gel right into that little space there. All right, and what the video talked about was a study. That study was done by Dr. David Waddell, and he's an orthopedic specialist, and that study showed here's a screenshot of part of it. On the basis of the survival analysis, Hyland GF20 was able to delay the need for total knee replacement in 75% of eligible patients by 7.3 years. Pretty good stuff. And the cool thing about this is they believe that it can actually delay it by much more than 7.3 years, but the study only lasted that long, okay? The study went on to say that this current analysis showed that Hyland GF20 continued to delay the need for total knee replacement in patients with grade 4 knee osteoarthritis over an extended follow-up period. And as you could see, grade 4 is a big thing here, because as you've already seen, grade 4 here, that's the worst case. They're having this success in the worst cases. So if you don't have grade 4, if you have grade 3 or 2 or even 1, most likely the results are better. Most likely, it's not as bad as this, okay? So the study also said the potential for Hyland GF20 to delay a total knee replacement was further demonstrated by the almost 11-year observational time for patients who did not require a total knee replacement following multiple courses of therapy. It also stated To the best of our knowledge, our study includes the largest cohort and longest observational period analyzed to date. So this study is important. Second one, Dr. Waddell put out on the subject. Both of them showed that it delayed the total knee replacement by many years. The first one showed 6.6 years. This one showed 7.3 years. But like I said, the studies more are going to be done to get it into the 10, 15, 20-year range, so we can see how long and the actual percentages 20 years out. A lot of patients, will they still avoid the knee replacement or not? Pretty cool stuff. The last notable limitation was the use of fluoroscopy during Highland GF20 administration. Although this technique is commonly used to ensure accurate needle placement in the joint, practices that do not use this technique may report a higher incidence of local pain and swelling after injections as a result of inaccurate needle placements. Therefore, studies with different methodological techniques may yield different results from our analysis. This is important because what we talked about up here with that grade 4, the video showed injection and this and that. It's very easy to miss this joint space, and studies show that up to 1/3 of doctors miss the joint space when they do injections blind. Blind means without imaging to see into that joint, okay? And we believe doctors would miss a grade 4 more than 1/3 because this is tiny space here. So the important thing was Dr. Waddell was talking about fluoroscopy, talking about imaging to see into the joint space and see the joint space up on a computer screen. And the slide doesn't show it here, but up top here there's a computer screen at NYC Pain MD. They have imaging that they can see into the joint space. You can see the joint. You can see the joint space. The patient can see it, and the doctor and the patient can watch the injection go directly into the joint space. So the doctor knows the technique was successful or not. Because if the injection doesn't go into the joint space, there's no chance it's going to work. So the cool thing about this is if you're thinking about getting a gel injection, it's highly recommended. We recommend you go to a doctor who has imaging so that they can see into the joint space to make sure the gel gets into the joint space, so you have the greatest potential to get the greatest benefits from this treatment. If you miss the joint space, it's not going to work. And this is what this shows here. If the gel goes into the joint space, obviously it has the greatest chance to work. If it misses the joint space, it can't possibly work. So you really want to, and that's what the study talks about here. He talks about that other studies show that the gel injections don't get the great results he got. He's surmising that they didn't use the imaging to see into the joint space, and that could really skew the results, because if they're missing the joint space, the results in the research aren't going to be good. That doesn't mean the viscosupplementation, the gel injection doesn't work. That means that's error in giving that technique, and it never had a chance to work. So that's why there might be some research out there saying that these things don't work, where Waddell, he's using imaging, and it also comes down to, in medicine, it comes down to skill of a doctor. And when doctors do more of these procedures and they do them accurately and they're good and they're skilled, of course they're going to get a higher success rate. At NYC Pain MD, doctors are specifically trained in this. They give hundreds and thousands of these injections, and they get tremendous results. So if you're interested, this is really great stuff. They offer a free screening, You can come in. It's 100% free. You can talk to a doctor. You can discuss your case. He'll tell you if you're qualified for this treatment or not. If you're not, they'll explain to you what treatments they believe you should get, or if you should be referred out. Total knee replacement might be what you need, but they're going to take a look at you and say, hey, we've seen people like this before, just like you. We think we can help you. Here's how, or we don't think we can. Simple as that. You're going to walk out that day with all of your questions answered, and you're going to be able to breathe a big sigh of relief, knowing at least what's going on, where your condition is, and what the best treatment options are. NYC Pain MD is located at 65 Broadway, Suite 1004, New York, New York. The main website is painmdny.com, and you can go there and you can check out a whole bunch of stuff that, they treat a whole bunch of stuff. You can see the videos, you can read stuff. If you want the specific study I talk about here, I'm going to put a link in this post. I'm going to put a link in the comments too, and you can click on that and you can go to that page and you can read about it, but you can also click at the bottom of that page. It will have a link that you can click to download this study, a PDF, the exact one, so you can read it yourself. If you'd like a screening, just call 800-301-4250. I hope this helps, and if you have any questions, comment below. And once again, I hope this helps.